Good morning, Paulette.
Yes.
Go ahead and come right in.
Good morning.
I'm going to go ahead and take your temperature before we head on back. Perfect. And while you were in your car, the front office went over the COVID questionnaire, so we do have those responses in your file. Welcome to King House Dental. We want to take a quick look around. We'll take you down the hall so we can take a quick tour before we have a seat. Go ahead and follow me right over this. To our brand new operatory. Used to be our consultation room, but we switched it up and changed it into our brand new operatory room 7. We'll come down this way. Room 5. Have a seat for me there. We'll go ahead and remove your mask now. We'll go ahead and switch with our oxygenated water that we have you rinse with just as a precautionary. Okay.
Hi, this is Jill, and I'm here with Dr. Tatevossian from King House Dental Group, and I'm just going to ask him a few questions about being a private practice during a pandemic. Okay, Dr. Tatevossian, in what ways has your practice been affected by the pandemic?
Well, in many ways, Jill. This year has been really tough for, I think, everybody. We have changed our entire infection control protocols. We were closed for almost 3 months, just seeing emergency patients to keep them out of the waiting room in the ER. But we're back to full speed now. I can go through details of what we've done to improve our practice for the safety of all our patients and staff.
Okay, so you probably have heard that it's been said dental offices are high risk for contracting COVID. What are your thoughts on that?
Well, I think the people who are at most risk are the dentists and the staff, because we're the ones seeing, all the patients. However, I can tell you that since the 90s, we've been geared up for protecting ourselves and our patients against HIV, AIDS, hepatitis, tuberculosis, and these are all viruses. They're airborne pathogens, bacteria, and we really have not had a major outbreak or contagion. So I don't believe it's any more dangerous than those other viruses I just mentioned that are much more contractable and infectious. So we are prepared, and I don't think it's any higher risk. If anything, I think it's a lower risk, especially since a new report came out last week where they surveyed over 2,000 dentists and found that there was only a 0.9% transmission in the dental office. So it's less than 1%. So I'm actually very relieved to hear that.
Well, it's good to know that you're confident. Do you think that your patients are afraid?
Oh, for sure. I think we were all afraid when we didn't have substantial information about the COVID earlier this year, March, April, May. And then I believe as things have gone by, we have changed so much of our infection control protocols. We now wear full surgical gear when we treat all our patients, even if it's just for a checkup or a cleaning. We wear head gowns, we wear COVID shields, we wear full surgical gowns, of course gloves as we've always worn. So we have implemented a lot of changes as well in the office. We now have true HEPA filters throughout the office that have plasma wave technology that just break up all the particles in the air. We sterilize and disinfect our operatories and use as much disposable equipment as we can. And we have the highest infection control protocols in place. So we've definitely been heightened our senses as far as protecting our patients go.
It sounds like you've amped it up quite a bit. Is there anything else specifically that you're doing to ensure the health of your patients, staff, and your family?
For sure. We all are screening ourselves every morning before we walk into this office. We are screening all our patients over the phone before they come into the office and have them fill out a COVID questionnaire that goes through many questions if they've ever been exposed, been out of the country, been exposed to anybody. And I will tell you, I am very happy with our response from our patients. We've had 3 patients who've called us this year and told us that they were exposed and that they didn't want to come in for at least a month, and got tested and were cleared. So the communication is very important, especially two-way communication, and I'm very proud of our patients for giving us the heads up that they may have been exposed and are quarantining themselves from coming in and exposing us. So I'm very appreciative of that.
Do you personally know anyone that's been diagnosed with COVID?
I know one person. It is a family friend of ours who did contract the COVID, and we have, in our 3,000 patient pool, we have had 3 patients who have tested positive but have not had major symptoms, and I have spoken to all 3 of them, and we took the precautions of waiting over a month where they were cleared and no longer tested positive and had the antibodies, like I said. So luckily we've been very fortunate not to have any deaths in our practice from the COVID.
Has your home life been affected by the pandemic as well?
For sure. I think all our home lives have been affected. I would like to say that I have better awareness when I go home. I'll scrub, take all my scrubs off, change all my clothing. I actually disinfect my shoes before I enter my house. Make sure I'm disinfected so that I don't pass it on to my family. And I think families are staying home nowadays, with the kids home from school, and I definitely don't want to put them at risk, but I'm not really overly concerned that I'm going to contract it or give it to any of my family members at this time. With all the protocols that we have in place, I'm very confident.